बट एक कोई बुक आप लोग को शायद मिला होगा ना, सम।
नहीं दिया मैम, इंट्रोडक्शन ऑफ
नहीं
फिजियोथेरेपी
मिला
का
नहीं
कोई
मिला मैम।
नहीं मिला। नो, एज
नहीं।
सच उसका ना कोई बुक नहीं है। दैट इज द प्रॉब्लम, बिकॉज उसका सिलेबस इतना ज्यादा फैला हुआ है, हर जगह से हर सेमेस्टर से कुछ ना कुछ लिया हुआ है ना, तो उसका कोई कंसोलिडेटेड बुक नहीं है। बट एक आध, आई थिंक वन ई बुक आई हैव ऑलरेडी सेंट यू, जिसमें से हिस्ट्री
यस
तुम लोग
मैम।
को मिल जाएगा, फर्स्ट पार्ट। एंड इफ देयर इज एनीथिंग दैट हैज बीन टॉट टिल नाउ, जिसका आपको नोट्स या जिसका आपको हैंडआउट्स नहीं मिला है, तो प्लीज लेट मी नो, बिकॉज आई कीप ट्राइंग टू सेंड एवरीथिंग। अच्छा, आई एम नॉट टॉकिंग अबाउट पावर पॉइंट, क्लास का पावर पॉइंट नहीं बोल रहे। हैंडआउट्स अगर या नोट्स आपको नहीं मिला है, तो जस्ट चेक इट वंस एंड लेट मी नो कि मैम फॉर दिस पर्टिकुलर थिंग वी हैव नॉट रिसीव्ड एनीथिंग। Anyways, I will be going through it, and the names are also set as such. Wait, I can check it right now, no? First semester
ओके मैम।
documents, let's see. Okay, so guidelines, standards of practice I have shared, body mechanics I have shared, then the past and future, yes, that is that includes some aspect of your, what do you call it. Okay, so I need to share a few more notes. Fine, what I'll do is I'll share all the notes that are necessary again. So in case it's a repeat, let it be a repeat. If it is not, if it's not, okay. I'll share it in WhatsApp. That way, like, you will have it. I'll share it in WhatsApp as well as in Teams. I think in Teams also I shared a few notes. Let's check.
हाँ मैम।
है ना? One or two are pretty big. जिसको download करना was very difficult. Sorry, to share in WhatsApp it was not possible. So that I have sent over here only. You can download it directly from this, what do you call it, Teams. Okay.
ओके मैम।
Hmm. Chalo, let's begin. So we will continue with positioning and draping. Today we'll finish positioning, and then we will move on to draping. Draping is actually not. Draping usually comes with your positioning. When you position a patient in a way, you have to drape the patient also. Draping in the sense you are taking a big sheet or a towel and then you are covering the person to ensure that the person is not exposed in a way which makes him or her uncomfortable. Okay. Okay, this is what we are going to talk about. Let's see. Copy. Yeah. The attendance link I have already sent, but it won't open now. It will open at 10:45 only. So don't try clicking. It doesn't make sense. Let's see. Share. And there is another thing which we need to do today. That is, there are some presentations which have to be done by you people. Okay. So I've already prepared a list of topics for that, and now I just need to distribute it. But unfortunately, I don't have a name list. So whoever is present, or I'll open the name list now. We will discuss directly, and we will, allot the topics so that there is no confusion. And then I'll share the final list with you people. Okay.
मैम कौन सा प्रेजेंटेशन?
See, for your internal
Like
assessment,
sociology.
आप लोग का internal assessment होगा जो, तो उसमें you people need to give presentations. There will be assignments based on which it will be done. Okay, and there will be one more one test I have already taken. So there will be one or two more class tests which will be taken. So we have to pick out topics from all the, sorry, marks from all this and give you internal marks. So that is why what usually I do is I take a lot of extra tests so that the best marks can be picked out, because maybe आपको एक exam में you did not do well but you did well in the other one, so I don't want your internal to get affected. So we have a repeated number of tests like that, but unfortunately I was not aware that the semester will come to a close so soon, so I didn't take any test for you. Oh, come on. Yeah, next week we will have one test. I'll message the details today itself. Okay. So
Okay,
to
ma'am.
continue with, yeah, what? Okay. Let's continue with the class then. When we were talking about the positioning, there was some aspects which we spoke about, ki why positioning is important, that you need to prevent contractures, isn't it? You need to prevent contractures. That is one important reason for avoiding disturbance to sleep, prevention of edema. Then came the point where there is prevention of pressure source. Now, even in that class, I had mentioned that pressure source can be a really, difficult thing to deal with, because once avoiding pressure source is very easy, but once pressure source develop, it becomes a very difficult thing to treat it. It's time consuming, as well as having pressure source make it very difficult for a person to go back to the normal functional capacity. Because imagine having a sore or a wound which is constantly, which is open, maybe if the grade if it's a grade 2 or grade 3 one, so then you find that there's an open wound. You cannot do physiotherapy properly in such case, because you cannot touch the patient and hold it over there, it will be hurting the patient. You cannot expect the patient to do movement on their own, because of course it will be painful. With an open wound, it's very difficult, and an open wound exposes the internal environment of the body to the external factors which can cause diseases. Because of that wound, see, understand, the wound
Yes.
is there, and what does
मैम
our
मैम
skin do?
आगे
Bolchi, bolchi,
नीचे
shop bolchi. See, this is, let us assume this is our skin. Okay, so this is the inside of the body, the internal aspect of our body, and this is the external environment. Environment. So what is the skin doing? The skin is protecting us from this external environment. It is not allowing the muscles which are present here, the nerves, the blood vessels, etc., to be exposed to the external environment, thereby maintaining a disease-free environment inside. Disease-free environment. Okay, but imagine having a nice pressure sore right here, and when the pressure sore has happened, this pressure sore is allowing, what it is doing is it is breaking the skin. Okay, it's breaking the skin, and because it's breaking the skin, see, the skin continues like this, and there is a pressure sore which is present over here. Now what happens is all the germs or the environmental foreign bodies can easily have access to the inside of the body through this pressure sore. And once that happens, there can be infection of the blood. You can have blood infection, you can get septicemia, you can have septicemia actually is the most commonly seen. You can have infection over the skin. Skin infections become common. Infected bones also get infected. Bones get exposed and infected. Get exposed and infected. Yeah. So this makes it very important to understand or avoid your pressure source. Now, where exactly in the body can we get pressure source, or our whole body is actually under pressure from the environmental factors. I am sitting, you all are sitting, we are sitting on the bed, our buttocks are on the couch. So that means there is a pressure which is over there. When we lie down, our body, different parts of our body are touching the bed. So there are pressures which is getting exerted over the different parts of the body. So how do we prevent pressure sores in this case, or what are the specific points which we need to be very careful about? So those points are known as the pressure points, the points in our body which are more prone to bed sores, or which are more prone to pressures exerted from outside environment, are known as the pressure points. And these are especially when the body is in a dependent position. Dependent position means either lying, supine lying, prone lying, side lying, sitting. So whenever it's in a dependent, when you are standing, you don't have the possibility of a pressure sore. If you are standing and walking around, there won't be a pressure sore that will develop. But the moment the body goes into a dependent position, immediately there is a possibility of getting the pressure points start getting affected or stimulated, and therefore the possibility of a bed sore or pressure sore increases. Is this part clear?
Yes, ma'am.
আরেকবার বোঝাবেন না
কোনটা?
ওই যে যেটা বলেন প্রেসার শটটা আর যে
তো this diagram is clear? ডায়াগ্রামটা বুঝতে পেরেছো? স্কিনটা এইভাবে যাচ্ছে, এখানে তোমার প্রেসার সোর হলো, ঠিক আছে? প্রেসার সোর যেই হলো, ইউ গেট আ বুম। তো তখন ওটা এক্সটার্নাল এনভায়রনমেন্টটা যেটা আছে, সেখানে যে তোমার ধরো মাইক্রো অর্গানিজমস বলো, হোয়াট ডু কল ইট, দ্য পলিউটেন্টস হুইচ আর প্রেজেন্ট ইন দ্য এনভায়রনমেন্ট, এই পলিউটেন্টস গুলো সব তোমার শরীরের মধ্যে যেতে পারছে। and when they are able to enter the body, so then depending on what part of the body or what's organ or structure of the body they are affecting, তোমার different types of প্রবলেমস হতে পারে। যেরকম যদি ব্লাডেতে গিয়ে ওই মাইক্রো অর্গানিজম গুলো ঢুকে যায়, তো তখন ইউ ক্যান গেট সেপ্টিসিমিয়া, ব্লাডের ইনফেকশন। স্কিনেতে যদি স্কিনের এই লেভেল গুলোতে চলে যায়, তো দেন ইউ গেট স্কিন ডিজিজেস or infection in the skin, something known as cellulitis. You can get cellulitis, not you as in the person who is cellulitis, the person can get cellulitis. Then bones, when usually pressure points are where the bony prominences are there in our body. Pressure points are usually present wherever we have the bony prominences. So when the skin breaks over that, the bone also gets exposed, and when the bone gets exposed for a prolonged duration, it will also becomes prone to infection. So you can have infection of the bones as well. Okay, so this is the reason why it is important to ensure that a person's positioning is such that প্রেসার পয়েন্ট গুলোর ওপরে খুব বেশি তোমার চাপ পড়ছে না। প্রেসার পয়েন্ট হচ্ছে ওই পয়েন্ট গুলো বডিতে যেখানেতে তোমার যদি একটা প্রলং ডিউরেশনের জন্য প্রেসার পড়ে, those points in the body if exposed to pressure, if they are exposed to pressure for a prolonged duration, then what happens is it can break down the structures between the skin and the pressure point. So the structures which are present, like there's the skin, there's the fascia, there's the fat layer there, those things can break down and the internal part of the body becomes exposed. That is why pressure points are important. Now pressure point গুলোর কথা তখনই আমাদের ভাবতে হয়, we need to consider the pressure points especially when we are in dependent position. Dependent position মানে হচ্ছে যখন তুমি বসে আছো, যখন তোমার বডির কোনো পার্টটা অন্য এক্সটার্নাল স্ট্রাকচারের ওপর ডিপেন্ড করে আছে। যখন আমি বসে আছি, তো আমার বডি পার্ট, আমার ব্যাক সেটা সাপোর্টেড থাকে, আমার হিপস সেটা সাপোর্টেড থাকে চেয়ারের ওপরে, তো সেটা একটা তোমার পার্ট হলো যেটা ডিপেন্ডেন্ট হচ্ছে। when I'm sitting there, if I'm sitting with a backrest, then my back is supported, it's supported by something external. Okay, so those positions wherever the body is depending on some external structure for stability, it is at that it is during such a condition we have to consider the pressure points. Next is what are the pressure points? Next question comes at what are the pressure points in the body. Now these pressure points differ. Different positions give different positions have got different pressure point. When you are lying in supine, there are different pressure points which need to be considered. When you are in prone, there are different pressure points which need to be considered, and that is why positioning becomes important. Ki how we have to position. Achha, not just for pressure points, positioning also is important when we are considering your what do you call it the in what optimal position, yes, the position, different positions which are there in the body, like not in the body, sorry, the different positions which our body can assume, supine lying, prone lying. So we need to consider them again. Why? Because optimal length of the muscles have to be maintained. Optimal length of the muscle. Optimal length of the muscle is important to ensure that there are no contractures, to avoid contractures. We will discuss this with each position. So now see, these are the pressure points which we are talking about. When a person is sitting with support, these are both sitting with support. Okay. There are two ways of sitting. One is sitting without support, and this is sitting with support. Now sitting with support, you notice the different parts. This you can actually do it on your own if you are right now sitting in a high chair.
ম্যাম গুড মর্নিং ম্যাম, লাস্ট 20 মিনিট ম্যাম কি হয়েছে ম্যাম একটু রিপিট করতে পারবেন ম্যাম শর্টে?
Le baba, someone repeat and tell him. কেবলজন রিভাইজ করিয়ে দাও। What? Someone do it. Vaishnavi. প্রিয়াংশু তুমি বলে দাও একটু ওকে।
কি বলবো ম্যাম?
আমরা কি করলাম এতক্ষণ?
আমি তো সবে এলাম।
কে এলো?
ও ম্যাম আমি তো ম্যাম বলছি।
ও আচ্ছা তুমিই বলছো, সরি। এরকম কেন হবে? কেউ বলতে পারবে না তা কি করে হয়? চলো, who will revise it? Who will repeat it? Pragya, can you do it? See, right now no one can hear me, is it? Priyanka.
আমি বলবো
হ্যাঁ, সৌম্য বলো বলো বলো।
ম্যাম স্লাইডটা একটু
আইডিয়া কি হয়েছে?
ম্যাম স্লাইডটা একটু দেখাবেন?
হ্যাঁ হ্যাঁ দেখাচ্ছি।
আমি একটু বাংলায় বলে দিচ্ছি। দেখ বলছি, এইটা দেখ যে ছবিটা দেখতে পাচ্ছিস, ওই ছবিটা হচ্ছে একটা স্কিন, ওই স্কিনের লেয়ার, ঠিক আছে প্রিয়াঙ্ক শুনছিস?
শুনছি বল।
স্কিনের লেয়ার, তো ওখানে দেখবি একটা লাল রঙের দাগ আছে, দেখছিস তো? ওটা তো স্কিনে মানে কোনো ক্ষতি হয়েছে, মানে খুলে গেছে স্কিনটা, বুঝতে পারছিস? ওখানে ছড়ে গেছে বা কেটে গেছে, ঠিক আছে?
মানে কাট হয়েছে স্কিনে।
কাট হয়েছে। দেখ এই ভেতরে হচ্ছে তোর ইন্টারনাল পার্ট, বাইরে হচ্ছে এক্সটার্নাল পার্ট, ঠিক আছে? মানে এনভায়রনমেন্ট আর কি। এনভায়রনমেন্টে তো অনেক ভাইরাস টাইরাস থাকে, ফরেন বডি থাকে, তো যখন এটা তো কেটে যাচ্ছে, ফরেন বডি গুলো তো শরীরের ওই ইনফ্লামেশন মানে ওই প্রদাহ জায়গা থেকে ঢুকছে, ঠিক আছে? এবার ঢুকলে কি হচ্ছে, তোর মানে বিভিন্ন রকমের রোগ হচ্ছে, যেমন তোর সেপ্টিসেমিয়া মানে তোর ব্লাডের ইনফেকশন, তারপর স্কিনে এফেক্ট হচ্ছে, স্কিনের ভেতরে, তারপর বোনে এফেক্ট হচ্ছে, ঠিক আছে? মানে ওটাই এতক্ষণ হচ্ছিল আর কি।
আচ্ছা আচ্ছা, এই যে ইনফ্লামেশনটা, এই যে বাইরে দিয়ে যে প্যাথোজেন যে ভেতরে ঢুকলো, ইনফ্লামেশনটা কি মানে এই প্যাথোজেন বাইরে দিয়ে ভেতরে ঢোকার জন্য হচ্ছে না আমাদের ইমিউন সিস্টেমটা অ্যাক্টিভেট হওয়ার জন্য হচ্ছে? এটা একটু বলে দে ভাই।
না, তো এইটা মেইনলি তোর বাইরের ফরেন বডিটা ঢোকার জন্যই হচ্ছে।
মানে ঢোকার জন্যই হচ্ছে? আচ্ছা।
হ্যাঁ,
অনেক সময় হ্যাঁ, মানে আমাদের যে ইমিউন সিস্টেম অ্যাক্টিভেট হলো তো অনেক সময় ইনফ্লামেশনটা হয়।
তবে এটা ফরেন বডির জন্য মেনলি হচ্ছে, আর যদি তোর হার্টের সামনাসামনি কাটে, ঠিক আছে, তাহলে তোর হার্টের ভেতরেও তো ইনফেকশন হবে গেলে, ঠিক আছে, ব্লাডে তো হবেই, স্কিনেও হবে।
আচ্ছা, আর কেউ, is there anyone else who wants to say?
বোনসটা নষ্ট হয়ে যাবে প্রিয়াংশু, বোনস গুলো যদি বোনস গুলোর মধ্যে ইনফেকশন গুলো হয়, বোনসটা নষ্ট হয়ে যাবে, বোনসটা ডিকম্পোজ হয়ে যাবে আস্তে আস্তে। মানে টোটালটাই বাইরে থেকে যখন এই মানে ভাইরাস বা যে কোনো যে
Decompose হবে না বাবা, bones decompose হয়ে গেলে তো খুব চাপের ব্যাপার আছে।
না ম্যাম বললাম না যে বোনস এমনি
Bones
লিখেছে, বোনস
exposed হয়ে যাবে।
এক্সপোজ বা ইনফেকশন হয়ে যাবে বোনটা, মানে বোনটা ক্ষয়ে যাবে আস্তে আস্তে।
এক্সপোজ আর ডিকম্পোজে কিন্তু অনেক তফাৎ আছে।
ডিকম্পোজ মানে তো আমার
हाँ
পচে
मैम, bones get मतलब bones exposed হয়ে যাবে and infected, not decomposed.
আচ্ছা
আচ্ছা,
এক্সপোজ তাহলে তো বলতে গেলে যেটা মানে ম্যাম যেটা মানে ক্ষয়ে যাচ্ছে তাই তো, মানে এক্সপোজটা
হ্যাঁ,
মানে কি হচ্ছে?
এক্সপোজ মানে তো
হয়ে যাচ্ছে না।
মানে তো
এক্সপোজ মানে
সামনাসামনি
it is
চলে আসছে।
just something which is visible now. আগে দেখা যেত না, তুমি কি তোমার শরীরের হাড় দেখতে পেতে না, এখন তুমি দেখতে পাবে।
আচ্ছা আচ্ছা
আচ্ছা, ওকে, এবার বুঝতে পারছি একটা মেজর প্রবলেম হয়েছে। We were not talking about injury. এখানে তোমার আবার শোনো, everyone listen carefully. We have the skin, okay, we have the skin, and there are bony prominences which are present under our body, isn't it? For example, the lateral malleolus, medial malleolus, আমাদের গোড়ালির কাছে যে হয়। So let us assume this to be the bone and this is your skin. In pressure point, what happens is when this part of the body, when this part of the body is in a dependent position, in a dependent position means it is in a gravity dependent position, let us say it's in a gravity dependent position, and this bone is exerting pressure over the skin. The injury to the skin is not happening because of cut abrasion. কাট অ্যাব্রেশনস বা অন্য কিছু গুলোর হচ্ছে এক্সটার্নালি হয়। এখানে তোমার ইনজুরি বা এক্সপোজিং অফ দ্য অর ইনজুরি টু দ্য স্কিন ইজ হ্যাপেনিং ফ্রম উইদিন, ইট ইজ নট হ্যাপেনিং ফ্রম আউটসাইড। ইউ আর নট, নো ওয়ান ইজ টেকিং আ নাইফ অ্যান্ড কাটিং, it's from the inside that the structures start decomposing. ওকে, এই বোন আর স্কিনের মাঝখানে যে পার্টটা থাকে সেটা ডিকম্পোজ হয়ে যায়, আর সেটা যখন ডিকম্পোজ হয়ে যায় তখন তোমার আস্তে আস্তে এই অংশটা এক্সপোজ হয়ে বেরিয়ে আসে। এটাই হয়েছে একটা প্রবলেম এখানে, ঠিক আছে, এটা এক্সপোজ হয়ে বেরিয়ে আসে, বোনটা, স্কিনটা এখানে হয়ে যায়, রয়ে যায়, তারপরেতে এই bony prominence, this gets exposed, but the factors are from within, it is not from outside. When this happens, then you have got the what do you call it, oh come on, then you have your wound which is present over here, which gives passage to all the external pathogens. এরপরে গুলো ঠিক বলেছো যে বাইরে থেকে সব জিনিস ভেতরে ঢুকে যাচ্ছে, সেগুলো ঢুকে গিয়ে তোমার ব্লাডের মধ্যে যখন যায় তখন ব্লাডের ইনফেকশন হয়। ইফ ইট অ্যাফেক্টস দ্য বোন, তো বোনে ইনফেকশন হতে পারে। ইফ ইট infects the structures of the skin, then cellulitis hote pare. So different conditions are there, but please understand that the pressure is from within, is from within.
নিজের থেকে ওটা
two
ডিকম্পোজ
forces.
হচ্ছে তো স্কিনটা,
হ্যাঁ,
নিজের থেকে স্কিনটা ডিকম্পোজ হচ্ছে তো।
বোনটা বারবার তোমার যদি ঘষে তাহলে তো স্কিনটা ডিকম্পোজ হবেই।
আচ্ছা,
See, তুমি when you are lying, okay, when you are lying in a position, you usually move. Even when like what we are doing, we do not sit like this. When we are doing classes, we do not sit like this for the same time. We move forward, we move backward, you move like this, you move like this. So what you are doing, you are actually changing the pressure points in your body. Okay, the ischial tuberosity is present. The ischial tuberosity is usually present on which we sit. Okay, on which we sit. So what we do is when we roll around like this, the pressure is not always on one particular point. It's not always on one
Ma'am,
particular point. Yeah.
ma'am, what is ischial tuberosity? Something you have said, right? What is
Oh,
it?
hip joint is not done, no? Okay.
No,
Ma'am, no,
ma'am.
ma'am. Till now, no.
Yes, ma'am, it's not done.
Different example. Different example. Ischial tuberosity is actually a part of your, what do you call it? Pubic bone. Pubic bone, we have a bone at the pelvis, and ischial tuberosity is present over there. That is, when you see the bone, sir will, Podia sir will of course show it to you. So when we
Sir,
sit,
ma'am.
that part is usually what is, you know, coming in contact with the chair or the bed or whatever you call it. Yeah. So what happens in such cases is that if you sit like this for a very long duration, there are layers of fat, there are layers of muscles, everything is there, but the bone exerts a pressure. The bone exerts a pressure. Now see, there will be, let us assume there is one layer of fat, not one actually, a thick layer of fat, let us say. So let this be the fat layer. Okay, then you have the muscular layer. So let the muscular layer be like this. You have the muscular layer also, which is present, and then you have the bony prominence, which is present. You have the bony prominence. It can be any bony prominence for that matter. You have the bony prominence. Now when a person, when this particular part is in contact with, let's say, a chair. Okay, let's make the chair of a different color.
মানে ম্যাম এগুলো যা হচ্ছে আমাদের পজিশনের এফেক্টের জন্যই হচ্ছে, মানে যদি পজিশনটা এক সময় সুপাইন থাকে সেটা অন্যরকম প্রেসার রিলিজ প্রেসার পয়েন্ট হবে, যদি প্রোন থাকে তাহলে সেই সময় একটা প্রেসার পয়েন্ট হবে, যদি হাফ লাইন থাকে তাহলে আরেকটা প্রেসার পয়েন্ট হবে, মানে বিভিন্ন ক্ষেত্রে বিভিন্ন প্রেসার পয়েন্ট হয় বিভিন্ন পজিশনের জন্য।
So let us assume this is the chair. Okay, এবার কি হচ্ছে, now what is going on is that when this chair is of course exerting a force, it's exerting a pressure over the part which is in contact with it. This is normal physics. Yeah. Okay. And gravity always pulls us down, whether we sit, whether we lie, whether we do whatever we want to do. So if we are in sitting or any position, the gravity will always tend to pull us down. Now this bone also then starts exerting force. Now when we are sitting for a long time in a straight way, we get pain in the buttock, and we, like, for a very short period, maybe we roll around a little, or maybe when we are sitting for a long time, we go, okay, we don't want to sit straight anymore, or we move forward. So we are never actually sitting on a same point. We are moving around, and the moment we move, the pressure which was getting exerted at this particular point, that also keeps changing. Sometimes it will be here, sometimes it will be here. But for a bedridden patient, or for a patient of stroke, let us assume, it's not possible, because they do not have this much freedom of mobility. So in such case, if you are putting them in one position and sitting for a prolonged duration, they will not go like this, they will not go like this, they will simply sit like this, the way you have put them. So what happens is, initially the force will be up to here, maybe this is where it is going, then gradually it keeps increasing the pressure. Prolonged duration, there is summation of the pressure, the forces which are acting, they start increasing, and it breaks down the muscle layer. Muscle layer is broken down. Okay, see, it has crossed. The muscle layer is broken down. Now what it does is it goes across and starts exerting its pressure on the fat. This particular thing we are talking about, and the structures, this muscle fibers which are present over here, the fat which is present over here, they start to degenerate. So it goes, exerts the force here again, and then further along it breaks the skin as well. So what happens is that this bony prominence then becomes exposed. That means there is a bed sore that has developed. There are different stages of bed sore. If you people must have seen the notes which I shared with you, in that it was with diagram, it was beautifully explained. So what happens is the pressure actually is exerted from within. There is of course external pressure also which is there, but the pressure points which we are talking about, they are present within the body. And when there is prolonged duration of pressure over these areas, then there is a possibility of bed sore. Okay. Is it clear now?
Yes, ma'am. Yes, ma'am. Yeah.
Now see, we come to sitting with support. So in this case, what happens is when a person is sitting with support, depending on what part, what kind of place they are sitting, so there will be different, pressure points. Like the back of the, it's a high backed chair. The chair has got a high back. So therefore the back of the head, more like the occiput. Okay, this is the back of the head. They can get pressure sores here. The bony prominence, actually when you sit and you touch and you try to feel which part of my body are actually in contact with it, which parts specifically are more in contact, or where am I feeling more pressure, you can ideally identify the pressure source. And these are, sorry, not the pressure source, the pressure points. So these are the points which are more prone to your bed sores. Okay, so there's back of the head. There is the shoulder blade. Acha, not the shoulder blade behind. Why? Because the spinous process is there. We have the
Yes, ma'am.
scapula. We have the scapula and we have the spinous process which is there. Yeah. So
Yes,
it is
ma'am.
at this part. It is at this part which it becomes very here and this part. Yeah, the spinous process of the scapula is a pretty prominent part in our body. If you touch it, you can actually feel it. And if a person is lying like that or sitting, sorry, not sitting, we are talking. So sitting like that for a prolonged duration, there is a possibility of getting bed sore over there. Then is the lower back. Lower back, of course, you see the points are very clearly shown, because that is where the main force is there. That is where we are maximally getting rested. So the lower back. Sacrum also, as I was mentioning, the ischial tuberosity, it's part of the, when we go towards the vertebra, the sacral bone also has a possibility of being exposed or being in dependent position. So if you actually press at the low back, if you go to the low back and then you start palpating down below, you can actually feel your sacral bone also. When they are sitting on the wheelchair, sorry, what?
বলছি হিলেও তো হয়, যেমন ক্যালকেনিয়াস বোনটা আছে আমাদের, ওখানেও ইনফ্লেমেশন হবে।
দাঁড়াও, পৌঁছাইনি তো এখনো হিপ আর সেক্রাম অবধি পৌঁছেছি। Then further down, if you are in a half lying position, then your feet are supported and therefore the heel, okay, the heel, as he mentioned, the calcaneal bone, that is the most one of the most prominent parts, so that is possible. Here the only difference is that it can be at the underside, not just at the back of the heel, where the Achilles tendon is. It can also be a little behind at the back of the heel. Okay, underside also, mane little towards the foot also, there also you can have pressure sore. And for people who this is also, this part is similar for those who are in supine lying also, because it's dependent. The complete thing is dependent. Okay. So back of the head means the occiput. Shoulder blade means the spinous process of the scapula. You have the lower back, you have the sacrum, then the heel. Heel means calcaneal prominence.
Ma'am,
Yes.
ma'am, here, ma'am, sacrum is referring to the, ma'am, that vertebrae only, ma'am.
Vertebra, yes.
Yes, ma'am. Then it is sliding very down, ma'am. The point of sacrum.
Actually, when you when a person, this lady is sitting in a very, beautiful upright position, but when a person sits with the legs up, like this, when they are supported, the sacrum actually goes down, because up to the lower back we have our lumbar only. So the it's actually where the, you have two dimples at the back of your at the back. Two tiny dimples are there at the lower back,
Yes,
and
ma'am.
below that is the sacrum. So when a person sits with support, it actually shifts down a little. And this actually should not have been the sacrum. It should have been ideally called the ischial tuberosity, which I was talking about. The more than the sacrum, actually the ischial tuberosity is troublesome, and it's all located in a straight line. So if the sacral bone is like this, this is the coccygeal bone, and if the sacral bone goes like this, then the ischial tuberosity is exactly at the same level. It falls around here only, the same level. So they are all at the same level, but sacrum is a little more inside than the ischial tuberosity. But yeah, fine. Okay. Now moving on to your lying down positions. This is actually side lying, and this is your supine lying. This is supine lying. So when in side lying, the ear lobes are a possibility. You have the shoulder exactly here, especially where your acromion process is. Then you have the elbow. You have the elbow here. What part of elbow do you think are they showing here? I'm pretty sure elbow is done. Tell me.
Sir, elbow joint.
Um,
Elbow joint.
Le Baba.
El-
Elbow joint has got different parts.
Ma'am, lateral epicondyle
So, ma'am,
The lateral epicondyle.
of
Ja, কোথায় গেল? Oh, these ones are better. Ha, yes. These ones are better. Yes, the lateral epicondyle. Good. Okay. So what this is doing is actually, it's these ones are actually showing the positions also, but okay, let's finish this first then. So lateral epicondyle.
ma'am, near to the humero-ulnar joint, ma'am, বলতে পারি?
হ্যাঁ বলো না। Humero-ulnar joint বললে it's a, you have the humerus, you have the ulna, everything is there, but most, when you are talking about sideline, then it's actually the lateral epicondyle. Okay, when in sideline, the moment, because ulnar means there is a lot of part which is covering over here, isn't it? So which part are we talking about? Elbow joint is a very pretty big thing. There are different parts of it, so you have to be very specific which part we are talking about here. So that is why you need to be careful. Okay, lateral epicondyle is there. Then actually Now olecranon does not fall in this. Okay, then you have the hip joint. In hip joint, you have the ASIS, anterior superior iliac spine. Anterior superior iliac spine. It's called the ASIS at the hip. When you place your hand over here, you can actually feel a bony prominence. The part where you wear your belt, that is your ASIS. Then of course the knee joint is there, the lateral aspect of the knee joint, head of fibula actually. Head of fibula. Then you have the ankle joint. Ankle you have the malleolus. The malleolus, which is the most prominent, that to the lateral malleolus actually. Inside lying. Lateral malleolus is something which is, you know, a very common site for pressure sore or pressure point. Okay, then the supine lying we will do in this one. Okay, see here the supine lying position. Now this is actually the red parts, or these are the main pressure points which we need to consider when positioning, and these are how we support the person. This is the position in which we are supporting a person. So you have the back of the head, as I mentioned, mostly the occiput. So therefore there is a pillow. There is a pillow which is present. You have to place a pillow over there. Then you have both the scapula. If a person is in supine, it's not just one, both of them. So what is done is there are some pillows, small pillows or towel rolls which are placed under the shoulder. So when the moment you place them under the shoulder, your scapula does not touch, or the pressure does not fall completely on the scapula. It gets distributed to the shoulder as well. Then for your elbow, you again have bolsters or towel rolls. Bolsters or towel rolls which are present, which you place under the hand. The whole hand is supported. See, it's not just the elbow, the whole hand is supported. Now this position which has been done with your pillows and all, it's not just to prevent the pressure points from getting activated or the pressure source, but it's also ideal for your for preventing contractures. Okay, so optimal length of the muscle will be maintained. It will ensure that the person is not in a a contracted kind of a position. They are relaxed. The muscles are relaxed, because if the muscles are not relaxed, they won't be able to move. Okay, the strength will not come back. So for that reason. Okay, now see, where did we go? Up to where we had reached? We had reached up to here. Sorry. Then you have the spine and the sacrum. See how the sacral bone comes over here. As I mentioned, see, this is the your ischial tuberosity which is present, and these have a tendency, this part, they all have a tendency of exerting pressure. When in lying down, the muscle bulk or the gluteus bulk is pretty huge. So therefore this part is can be ruled out in sitting. But see over here, the spine and the sacrum, they have a tendency of exerting pressure. So therefore that is something which needs to be kept in mind. And for that, what we have done, we have kept a pillow under the knee. Under the knee, a pillow has been positioned. The moment you keep a pillow under the knee, what happens is it kind of elevates the hip at an angle. The moment that happens, the pressure exerted on the spine will reduce. It reduces. These can only be experienced when you actually do it on your own, or you try it on someone else. It cannot be theoretically understood very well, but when you position a person like this, you will find that most of the pressure has been relieved. It's very relaxing. And of course, to prevent anything at the heel, sorry, this is the calcaneal bone. So for the heel, you place a pillow under the heel. Okay, under the heel, a pillow is placed. Even if the person wants, they can move it around also if they want, if they don't want, whatever. So this is how we position a person in supine. When it comes to positioning and draping, you might be asked ki, how do you position a person in supine? So then you have to mention the pressure points which are there and where all you will be placing the pillow. So this is something, this of course this PowerPoint I'll be sharing with you people. So what you need to do is you need to go see these pictures and make a list. Where exactly are the, for supine position, these are the these are the pressure points, and this is where the pillows are being, or the towels are being placed. It's very clearly visible. All you need to do is just go through it, and I think even in the notes which I had sent, it was there, but still. Now comes your sideline. In let's see, what's the time? In sideline position, we have already discussed which one comes. At some aspect, the ribs might also be a bit of a trouble. See, the iliac crest falls, comes here. We need to consider it. The greater trochanter is something which has to be considered. The medial and lateral condyles, because the medial condyle, you'll be like, why the medial condyle? Because pressure sore can develop between two knees as well. If the two knees are on each other for a very long duration and both the condyles are pushing at each other, then pressure sores can develop at the inside of the knee on both the legs, and therefore we have to place a pillow. So if you see this is actually a position. This is how you position for sideline. This one is actually Sims position. This is known as the Sims position. Sims position is actually a more, it's not like half lying, it's more of a half prone kind of a position. Now we will see it in prone again, but in this what happens is, see here you can see both the hands, here you cannot, because the other hand has been turned around. So the person is like this. In supine, in sideline, the person is like this, both the hands are together. But in Sims, the person is in this way. So the other inside shoulder is actually away from the other aspect. Now see, where all do we place the pillows over here? One, of course, at the head to support the neck, to support the ear. Then you have your, what do you call this? A pillow at between two hands. Okay, when you have pillows between two hands, this also ensures that the shoulder is not in a very rotated position. It's not in a very rotated position. If my shoulder is constantly like this, what will happen is it will cause tightening of the pectoral muscles. If my hand remains like this for a very long time, and please understand, we are not talking about normal people over here. We are talking about people who have some problem like stroke or hemiplegia, or those who are unconscious or semi-conscious, those who are not able to do the movement on their own. এটা ভীষণ দরকার বোঝা, যেটা কিন্তু নর্মাল তোমার আমার মতন মানুষের জন্য বলছি না। তোমার আমার মতন মানুষেরা জানবে কখন কোল বালিশ নিতে হবে, কখন তাকে মাথায় বালিশ নিতে হবে, কি করতে হবে। These are all for patients. These are all for patients. Then you place one between the knees, between the two knees, and the knees, upper knee, if you notice, this knee is at an angle. It has been moved a little forward at an angle. It's never kept straight. The lower knee is kept straight. So what happens in that is both the knees are not actually touching, and both the knees are not putting pressure on each other, because this one is a little further ahead. Yeah. Okay, that's it. Many times we also place a small towel under this part. A roll of towel is placed here. Okay, now see, the Sims position is here. This is actually to maintain the foot in a neutral position. Whenever we place a towel or a pillow like this, it's usually to maintain the foot in neutral position, because there is a possibility that it might be excessively plantar flexed. In stroke patients, it's commonly seen. They lose there's something called a foot drop, and they have a tendency of leaving their foot in plantar flexion for a long time. Plantar flexion is, this is the foot, plantar flexion down below. Okay. Now comes your prone position. See, in prone position, you have the cheek, again, cheek and the ear. You can get, a person can get pressure source at the cheekbones. In our face, the cheekbones are the most prominent part. So the cheekbones, and of course, again, the earlobes. Earlobes are also very common. So cheek and ear, because in prone lying, we do not lie with our face inside the pillow. We usually have our head on one side. So that side ka cheek and ear. Then the acromion process, because it's forward, so the acromion process can be is a pressure point. In women, breasts also become one of the pressure point, more prone. In then of course the anterior superior spinous processes are there. See, ASIS, both of them on both the sides. Okay, then in case of male, the genitalia, as in because yes, the genitals of the male also are more prone. Then you have the knees, especially the patella. Patella is pretty prominent. Tibial tuberosity, they are also having pressure points. Then you have the toes. You have the toes, which, because if the feet are like this and the toes are constantly touching, or the toes are constantly putting pressure, then of course the toes, you have the small bones in the toes which tend to push forward. That is one aspect. So in such case, what do? We have not many things needed. We have one pillow, of course, on the at the head. Then you have one at the level of the hip. So when you place it at the level of the hip, now here it prevents, or it releases the pressure from, removes the pressure from your anterior superior iliac spine, as well as in case of female, the breasts won't get that much pressure, because there is an angulation that happens, isn't it? There's an angulation that happens. So therefore it lifts off the pressure over there. And for male also in the same way, because the genitals are present over here, it removes the pressure. It's supported by the pillow. So therefore for male also, for both, ideally male and female, the same position is used. Then you have one where you place it under here. The moment it is placed over here, it might seem that the knees are still getting a lot of pressure, but what happens is a big pillow is taken. So the pillow kind of extends from just below the tibial tuberosity onward, and that prevents, that releases the pressure from the knee joint. And here, of course, your toes are supported, so there's no point that it will get, what do you call it? Yeah. Achha, these all you will find. Saunders you will not get now. Saunders you will get in higher classes sometime. That too reference most probably. So these are all from Saunders only. Okay. This is again the Sims position. As I mentioned, we will be discussing it again. So see the Sims position. The hand is here. So this is actually not even completely prone. This is semi-prone. And this is not side lying also, because the person is actually lying on the front, on their abdomen only, but a little tilted outward. Okay, so this is how you support it. You give one pillow at the hand, because this is how it will be. So the hand is at the level with the body. That ensures that the pectoral muscles are at a proper length. Of course, the other hand has been removed outside. Then you support. Why am I yawning so much? Sorry. So then you have what do you call? Yeah. Then there is another pillow which is placed at the level of the knee to ensure that there is a little, the position is half prone. You need to support half the body, isn't it? For that reason only you place one more pillow over here. And another reason is that it supports the knee joint, the ankle, the malleolus which is present, to prevent any pressure in such cases. Okay. These positions are all clear?
Yes, ma'am.
Yes, ma'am.
Good.
Yes,
Sims position. Semi-prone. Now comes your semi-Fowler's position also. So this is almost similar to how your position, what parts of the body are dependent, same as the half line. It's similar to the half line position. So in semi-Fowler's position, what happens is, there are different positions actually. Fowler's, see, there are 3 angles in which it is given. So Fowler's position is when a person is in half, the person is half sitting, and the angle between the bed, angle of the support and the what do you call, 90 degree is, or the ground is actually 45 to 60 degree. Okay, the angle between the backrest and the ground, that is 45 to 60 degree. When it is 45 to 60 degree, it's called Fowler's. Then when you take it down to 30 degrees like this is 30 degrees. The moment it goes down to 30 degrees, it becomes semi-Fowler's position. Because 60 degree, up to 60 degree, we are considering Fowler, and we are halfway through there, so therefore it's semi-Fowler. And if it is all less than 80, if it is less than 80 but more than 60, less than 80 more than 60, then in that case what happens is, it's called a high Fowler's position. These positions are usually seen or taken, considered important for patients who have got orthopnea. That means people, when they lie down, they have difficulty of breathing. People who have difficulty of breathing in lying position, those are called, in such cases, we require these positions. So along with your supine, prone, side lying, now you know about the Sims position as well as the semi-Fowler's position. There is another one which is Trendelenburg position, but we will not go into that today. Not today means not now, not really necessary for you to know. Trendelenburg's position. It's actually a head down position. So the head is here, and this is how. Okay, this is how it will be. This is your Trendelenburg position. That is, the head remains a little down. So it is seen in cases, especially for postural drainage and all. So therefore, it's not seen for postural drainage and other aspects. So for that reason, we don't really need to go into it today. Sorry. Achha, where is draping? Oh. 1 minute. Okay, there is draping also that needs to be done, but before we do draping, see, draping doesn't really have a lot of things to be covered. Draping simply means that you use a large sheet to cover the person. Okay, why am I doing this? You can't see. Where did it go? তো when you are কেমন আছো? হ্যাঁ আসছি, হ্যাঁ। Okay, so where did it go? Yeah, draping. Now, as the name suggests, draping means you use a large sheet or a towel to cover the patient. That is basically what draping is. Okay, and why do we need to cover the patient? To protect their modesty. That is actually the reason why we drape a person, because when a person comes to you wearing clothes, especially see earlier when our these tights and all were not much into fashion in that time. They were, but usually people didn't come for treatment and all that. We used to tell them ki please wear salwar suits, please wear loose jogging pants for men, please wear t-shirts. So what happens is when patients come to you wearing really tight clothes,